Dr. Cora Constantinescu is back with us this morning, a pediatric infectious diseases specialist with Children's Hospital in Calgary, which runs the vaccine hesitancy clinic. It's good to welcome you back, Dr. Constantinescu.
Good morning.
Good morning. You were listening to Deanna's reporting. I'm just wondering, if we go back to November when it was approved in Canada for vaccination for kids 5 to 11, what were your expectations for what the level of uptake would be?
You know, we had surveys done before the vaccine rolled out that actually pointed to about 50 to 60% of parents being ready to take the vaccine as soon as it was available to them. And we know we didn't get to those numbers right away. And in some places, we still haven't gone to those numbers, except in some provinces like Newfoundland, where they've done a really good job of protecting their children, and kudos to them. But we know that those numbers did not quite get there. So that tells you a few things.
Well, which I want to talk about. Let's bring in the numbers just so everybody understands this. Nationally, here's the official figure. At least one dose is just close to 46%. And as you quite rightly point out, Newfoundland and Labrador has the best record as a province or territory for at least one dose. It is over 70%. Alberta, the worst for its children 5 to 11, with just over 35%. So it started out rather promising, but then it has dropped off. And I'm wondering, as you talk to parents, children in the clinic there and in your practice, why do you think that is?
Well, there are a number of reasons which I think are all going to change very soon. So when you see that the intent is higher than the uptake, the first thing that makes me think of is access. So we know that in some places this is still hard to get for parents, and we need to get rid of any barriers to access, whether it's booking the appointment, whether it is where it's given, so having it more available, like some places in Ontario where it's given in schools, giving it in pharmacies, making this as easy as possible for parents to go ahead and make the decision to vaccinate is important. Issues around confidence were key as well. We know that even before this was rolled out, parents were worried about myocarditis. And now we know that in this age group of 5 to 11, almost 9 million doses in the U.S., and very few cases of myocarditis, around 11, all recovered or recovering. So we know that this is now a safe vaccine, and that same signal of myocarditis is not there in the 5 to 11 age group, which is very reassuring. And then lastly was this issue of, does my child need to have a vaccine? And I think Omicron has changed that. And especially as Alicia pointed out, and a few of the other parents you had, we're sending our kids back to school. Infection rates are higher than ever, and we're seeing more kids than ever in hospitals with COVID as well.
Okay, so pause right there. So that is the case for improvements. It sounds like you're optimistic that in terms of access, things are going to change, and they will have greater access to this. We know there's a supply. That was made clear this week for kids who are now eligible. We got some viewer questions for you, Dr. Constantinescu, and I love your answers to them, because information often changes action, obviously, so transparency and information. Bianchi has a question that you spoke to right there. She just wants to know, is it truly a need to vaccinate children?
Yeah, so I thought there was one before, and now more than ever there is a need to vaccinate children. We are seeing more cases of COVID in children than before. We're seeing more children with COVID in hospital than before. And the U.S. released data which confirmed what we're all seeing, and that is that 99% of kids in hospitals with COVID are unvaccinated. So that's pretty powerful there. There's a need to keep children out of hospitals, to keep them away from severe disease. And I think soon we'll also show data that shows that it also decreases the likelihood of children bringing it home.
Similar question from Kathleen, or at least looking at the consequences of children becoming sick with COVID, with kids that are just now eligible for vaccines, as Kathleen points out. In her mind, that makes them a large portion of the unvaccinated population. So she'd like a little bit more detail, Dr. Constantinescu, in terms of how that's translating into illness and hospitalizations. There's some firm hospitalization data in the United States for pediatric hospitalization. Are we starting to see more of that in Canada as well?
For sure, we are. We're starting to see more kids in hospital with COVID, and we are seeing that this is mostly among the unvaccinated that end up in hospital. And she's right, those kids under 5 are unvaccinated.
Mike has a question about kids in the same age group. Sorry, not in the same age group, but actually kids under 5 who are not yet eligible for any vaccination. The research continues for that age group. Mike's question is interesting, considering their social interactions are almost completely limited to parental interactions and socialization. Isn't it possible the increase in cases for the age group of under 5 could be attributed to the increased confidence and socialization of the parents who are vaccinated?
I mean, for sure, there's a component of that. We know that those kids do tend to take it more from parents. However, anytime we've seen an increase in numbers in our society, in population at large, we've seen a higher number among our children. So we know that, kids are safe from COVID if the numbers in the population are low. So that's been correlated the whole time.
A question again for this age group, Dr. Constantinescu. So without a vaccine at this point, under 5, Daniel and Rosemary have similar questions, so I'll put them together. Daniel is wondering what the risks of kids are to those who are under 5. He has a 3.5-year-old, wondering if they should avoid small indoor gatherings, even though people in those gatherings, everyone else might be vaccinated. And similarly, Rosemary wondering about, for that age group, not just the small gatherings, but again for junior kindergarten, for those who are off to school themselves or daycare. So what are the particular risks to them?
Yeah, so there are two big categories that concern me in this wave, in this fifth wave. One is the unvaccinated, and two are people who have underlying condition or immunocompromised. Those are the people who now, and we're seeing, those are the people who are now being hospitalized, who have severe disease. So you have to think a little bit about your family. If you do have an unvaccinated child at the age of 5, I would say reduce your social interactions, your in person as much as possible. I don't think this wave is going to be as long as the other waves. I think we're going to see it peak soon, and I'm hopeful that this is not going to be as long where we have to hold kids back from things. But, there's value if your child is unvaccinated to trying to reduce their interactions. Now, whether that means keeping them from school is different, and it's, I think, up to every family to make that decision. But I would also say the other important thing is that if you do have children in your household who are over 5, who are not vaccinated, who maybe had 1 dose, and you have the opportunity to give them 2 doses, consider that, because again, you're trying to protect the unvaccinated in your family to reduce the likelihood of this coming home and infecting them.
On the 2 doses point, before I let you go, we've had this conversation before. It is an 8-week window, but with allowance and with parental consent, parents can shorten the gap between the first and second doses for their children. And is that your best guidance at this point, Dr. Constantinescu, to do so?
Yeah, I think it has great merit. We know that the 8-week made good sense in terms of long-term protection and also around the fear of myocarditis. But I think that has been put to rest now, considering the millions of children immunized, and we're not seeing a significant myocarditis signal. So that's been taken away in light of Omicron and the likelihood of children getting infected. And I really think you're making the choice of either vaccinating your child or getting Omicron. I think the infection rates are so high that it's great. It has merit to reduce that interval so we have children immunized faster, of course with the caveat that they may need a booster down the road, but I think most parents would be keen to take that. And again, it makes good sense from the perspective of saying we think 1 dose is going to keep kids away from hospital, but I don't think it's enough to keep infection away, whereas 2 doses is going to improve the likelihood that your child's not going to get COVID.
Okay, so I'm listening to you and I'm hearing loud and clear, get vaccinated or get your child vaccinated, get the second dose quickly whenever you can. With so many either heading back to school next week or already back for in-person learning this week, what's a final message on vaccination this morning for parents, Dr. Constantinescu?
I know this is tough for parents. I'm a parent myself, and it's been an emotional week, especially as we in Alberta have got back to school. We want to prioritize education and have kids back at school, but we're not powerless. You do have the ability to protect your children by getting this vaccine, and we're now seeing that this is a safe vaccine and it works. So consider that and go ahead and do the best you can for your kid, which is protecting them. This is the biggest vaccine preventable threat to our children right now.
I will look forward to our next exchange and your next visit to our program. Thanks a lot, Dr. Cora Constantinescu in Calgary.
Have a good day. Thank you.